community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to the show. Staying hanging out with you on one of your favorite segments here on Bobo 103.1 FM, a show dedicated to all things HSA. And we usually have different departments, segments, workshops that we're talking about, all brought to you by HSA. We have a very special doctor here joining us here in the studios today. It is my pleasure to welcome Fabian Blanc. Am I say that right? Did I say that right? Yeah. Yes. Fabian Blanc is in the studio with us today. I dare to say, because I didn't put your specialty here, but just based off of the conversation that we're going to be having, you're in dental care, correct?
Right, dental caregiver. I'm a dental therapist.
I love it.
Yes.
Love it. So it's 2 for 1. So, well, 2 for 3 so far that I've gotten right. And this is all surrounding around, of course, National Children's Dental Health Mouth Speaking Points. Oh, sorry, I think I read everything there. Is this supposed to be National Children's Dental Health Month? Is that correct? Right. Yes.
Correct.
I read too much into that one. All right. So listen, it's a pleasure to have you here. Thank you for being a part of the show.
Pleasure for having me, sir. Thank you for having me. I'm really, really honored to be here on this platform.
Yeah.
And just to spread the awareness of the importance of dental health, not only for children, but for adults as well.
Absolutely.
So it's a pleasure to be here.
Long are the days that, I don't know if this still happens, by the way, but parents used to always tell you why it's important to brush your teeth.
Yes,
and then they always check with you in the morning or after a meal. Or I still see people to this day. I always look at those are the ones that are very psycho about their dental care, but they bring their toothbrush to work.
Definitely.
I see people do that.
Yeah. We encourage that. In terms of...
Is it necessary, though? You encourage it, but is it necessary?
It depends on the individual. So what we encourage mostly is in terms of frequency of brushing.
Yeah.
It would be like twice a day. So it would be morning, of course, after breakfast.
Yeah.
And evening after you have your dinner. And that would be it.
Yeah.
If you would go to a third time or brushing 3 times a day, we would really ask you to do a light brushing, as very light as you can. So for those who bring their toothbrushes to work, we are asking you not to do a heavy brushing. Because frequency in brushing leads to a particular problem called recession.
Yeah.
Where the gum would move down eventually, and then it would heighten. It would cause sensitivity. You know, whenever you're eating that ice cream or some that cold drinks, you will have that crumping feeling. So we really do not want that. So we ask you to just do as light as you can.
Yeah.
Don't apply much pressure. But to counteract that, we ask you to just do a nice rinse.
Yeah.
And of course, use a sugarless gum.
Okay.
Yeah.
Okay.
And that would do the trick to kind of clean the mouth and freshen it up nicely.
I laugh at individuals like that all the time. And the reason I do, hear me out, doctor, on this one, is because every time I go to, like, my daughter does this, right? And so does my wife. They're very, when it comes to dental care, they're very serious about it. But then what I find is when we both go to the dentist would look at me and be like, perfect. And I'm the one that always forgets sometimes, right?
Yes.
And then it's like, perfect, you're doing great. Keep up what you're doing. I'm like, I'm not doing much. And then my wife, who's a perfectionionist at this,
she has
major issues. And I'm like, shame on you. And you're always trying to warn me. We'll talk about that later.
Life is unfair sometimes.
It is unfair.
It's unfair. And it has to do with, sometimes a lot to do with genetics.
Yes, I've heard.
Yeah, it's a lot to do with genetics. Sometimes some persons, as you rightly say, would be ardent in brushing, but they have the most problems. So we really want to kind of gauge it and just educate persons as to what they can do.
Absolutely.
To have a healthy oral health.
You work directly with the HSA.
Yes.
How long have you been there?
I've been here 7 years now.
Oh, wow. Good.
I've been with the HSA 7 years and counting.
Yeah.
And it's a wonderful experience.
Yeah.
How the things are organized, it's really nice. I mean, I know that there's need for more mental health professional because we see that the population is expanding.
It is.
And yes, we see that, but plans are put in place to ensure that we serve everybody.
Yeah.
Yeah.
Is there days, and you're allowed to answer this with being employed, the HR department tries to keep you guys as honest as possible, but there's days, some mornings I just don't want to be on radio. Is there days that you're coming to work and you're like, don't want to see a next mouth?
Dental has a particular dynamic to it. So it's not just you just doing the routine all the time. You have different disciplines or areas that you focus on. So there are days when you might not feel like going into a particular discipline. Yeah. But you focus on something else that would kind of lighten up your day. For example, just meeting, interacting with the patients. Yeah. And listening to they're giving the experience, let them, and I'm talking to them about their health and even some about their troubles, their social life, kind of lighten you up and give you a different perspective because you are able to point to that particular person. Yeah. Because we recognize that, of course, not only dental health is just a part of the individual. Yeah. So we want to ensure that that we try to touch every aspect of their lives.
I like how you put when you first acknowledged the question and you said, well, this particular discipline area is what I have to engage with today. I love how you use the word discipline because that's what it is. It is a discipline. So that's how everybody should approach their job. My first question to you, Dr. Fabian, is what is Children's Dental Health Month? Help us to examine that.
All right. So Children's Dental Health Month is a time that is given for the observation or observance of oral health, particularly for children. Yeah. And that time is in February, which just passed. So the entire month of February, and I know that we also allocate the month of February to Black History Month.
Yeah, we do. Yeah.
but the American Dental Health Dental Association, which is the ADA, designated this month so that there can be a collaboration between the dental health professional, the caregiver, which is the parent, and also educators. Yeah. So we are bringing all three persons together, and we're saying no, because we want to raise the awareness and importance of maintaining good oral health. Yeah. The truth is, most persons might not see the importance of oral health, but I ask you the question: when you see someone for the first time, what do you see? I mean, they look at you and they smile at you. And the first thing that you see is their teeth when they smile.
We notice it right away.
And right away. Yeah. And if persons are not too confident about their smile, then it comes off in the way they interact with you.
I know people that when they smile, they literally cover their mouth. Exactly. I've seen that a lot.
Exactly. Yeah. Exactly. And so we want to use the opportunity to say, okay, now we don't want to bend the tree when it is grown, when it's an adult. We want to actually bend the tree or curb the tree in terms of, I'm talking about lifestyle practices when it is young. So that's why we are starting at the grassroots level, and we are saying to the teachers and to the parents that this time or this month is a month where we really want to bring you up to speed as to what is happening, what is transpiring, even in the schools.
Oh, wow.
Even in the schools.
So good. And we talk about like the first thing that you see when you see an individual. This can be relatable to a child too, because we're talking about child month and dental care, right? Mm-hmm. I remember when my son was growing up, he's obviously going to be 17 this year. But one of the things I noticed quickly is that I don't know if he took care of his teeth as early as possible. Mm-hmm. There was always that thing where you depended on your child when he was a certain age that he's going to go brush his teeth. So it affected him later on. Mm-hmm. And I just remember he had to get braces, right?
Oh, yes.
Now, because of his insecurities, even after he got like perfect teeth, brushing his teeth all the time, pearly whites, he still was insecure. So I noticed this because he took a lot of photos with not smiling. So I thought it was a thing. I thought it was like a tough guy thing that he was doing, right? Like what teenage boys try to do. And I found out he still was thinking that his teeth was the same way that it was. Oh. So he never let that go.
So he was scarred mentally.
Yeah. So even when it's pearly white, he's looking like a hamster in a lot of his pictures because his cheeks are puffed out and he's like, he's not smiling because he's insecure. So you're right. you're right about the insecurity part, or you just feel weird about your mouth and stuff like that. But yeah, go ahead, doctor.
And one thing that I really love about working here in the Cayman Islands is that, well, I've worked in 3 different places. I've worked in Jamaica, I've worked in Dominica, where I'm from.
Oh, wow.
But what I noticed about the model that the Cayman Island government, I mean, all through the ages, would have established, and really and truly, it is remarkable. It is really, really wonderful.
Yeah.
That they take the effort to put in place an effective school system.
Yeah.
Did I say effective?
Yeah, you did. You did.
Effective school system that caters for not only for the primary school and high school, but we also touch the preschool as well.
Yeah.
Where we focus on education, we do screening for them, and we touch the life. We talk to the parents. So for all of those 3 stages of the child's school life, HSA or the dental healthcare professional is involved in some way or another in that child life. And as we go later on, you'll see where it has a lot of advantages, even for the parent. It saves you a lot of time and money, but we'll discover that as we go along.
Absolutely.
Discussion.
Absolutely. I love how passionate you are about your job too, doctor. Let's talk about why early dental care amongst kids is so important.
What do you say in health overall, that early detection save lives overall? Yeah. And you've been hearing that all through, even with for women, breast cancer, and for men with prostate cancer, those prominent cancers. Even with dental, when you come into the dental world, we are saying early detection also saves your teeth. This is where we come in, where parents are asking, well, at what age then?
Yeah.
Should I begin? Well, we recognize that you should begin at the age as early as 1 year old. So you can begin earlier. What we want to do is that because you are detected, or we detect anything early, it prevents cavities, it prevents infection, it prevents pain. Also, it supports speech development. Now, and the reason why I say speech development, because most persons don't think that your teeth is needed for speaking.
Yeah.
But it is very important.
Yeah.
Placing the tongue between the teeth so you can pronounce certain words, ST words and PH words is very important.
Yeah.
Teeth development is good. So once you detect certain things, we can remediate it, correct it, and allow that child to develop properly.
Yeah.
It also reduces absenteeism from school. Once a child is in pain, you have to seek dental care.
Yeah.
Remove that child either 1, 2, or 3 times from school within a particular month. Not only would that child miss time from school, but also the parent would miss work times.
Yeah.
From work.
Yeah.
And you know how that is in the working world. That employer will not be too happy to know that, okay, yes, although he might be, of course, sympathetic towards you, but then he says, I cannot be missing so many times. I need this production. I need this to be done. So here we are encouraging parents, listen, early detection saves your dental health life, basically, or promotes good dental health.
Well said, and definitely very informative. But I know that you touched on a few stuff when you're very excited when you talk about the dental school programs, right?
Yes.
What is the main aim of the HSA School Dental Program, in your opinion? Because you work closely with the schools.
Yes.
Yeah.
I do work closely with schools, and what we are seeing, what we are striving to do at HSA is to prevent and control oral disease through organized community efforts. We also want to partner with the parents to collaborate with all other healthcare providers. We've been doing that, particularly at the entry level when we see that students now are entering primary school from the preschool. We have what we call a screening session where we collaborate with the public health nurse. So we want the parents to know that this is just as important in terms of other aspects, whether you're receiving your vaccination, whether you're receiving all of the different things in health, the eye test and the hearing test and stuff like that. Dental healthcare is also part of the entire development of the whole child.
Yeah.
So this is our aim, so that parents can ensure that their children are free from pain and infection, And if they notice anything, because we also want to train parents to be liquor dental detectives as well.
Absolutely.
So you'll be looking consistently in the mouth. Based on the education that you receive from us, you should be looking every day in your child's mouth. And if something is off, we ask you to come to us.
Yeah.
And it's just over the weekend, I had a parent just send me a photo. And I say, I like this because I'm able to kind of rectify this or educate that parent and say, no, this is what is happening and you should not fear. Or rather, in other cases, we can say, okay, visit the dentist or come to us and we can, rectify this problem. So we really want to build that relationship, foster that bond between home and the dental clinic, between parents and the dental health care provider. And by building this, and we're seeing that we are gaining traction here in the Cayman Islands through the HSA intervention or dental program, that we are gaining traction in having a close relationship with our parents.
Yeah. I love it, man. We were talking to, by the way, for those that are just tuning in for the first time, we're speaking to Dr. Fabian Blanc, and he is obviously a dental therapist. And any questions that you have, just go ahead and send it to our social media at Bobo 103.1 FM. One more question before we go to a quick commercial break. And that is, of course, we're talking about the programs in the school and just how exciting those information they sound. And I'm glad that you guys are in the school system from early. Which schools are benefiting from this program right now?
Oh, yes. I can say clearly it is all of the government primary school and high school.
Love it.
All, and let me just list them so that persons who are listening
absolutely
would know or would basically identify with that. So we have the two high schools, which are John Gray, of course, in Georgetown. We have Clifton Hunter in the North Side region.
Yeah.
And also we have the primary schools, all 8 primary schools.
Love it.
Government primary schools. John A. Cumber, that's in West Bay. We have the Sharon Marie Martin School, that's Georgetown. We have Red Bay Primary School, Prospect Primary School. All those 4 schools, what we have, there is fitted in all of this, even 6 of them, which is John Gray, Clifton Hunter, and 4 primary school that I listed. What is fitted in there is a permanent dental clinic.
Yeah.
So now we go to the eastern part of the island, which is Joanna Clark. We have which is our Savannah Primary School. Theolin McCoy, which is Bordentown. Edna Moyle, which is North Side, and we have East End Primary School.
Okay.
So all those 4 schools are serviced by a mobile dental clinic. So have you ever heard of the swimming program that is right?
It's exciting,
so it's the same thing.
Yeah.
So what we do is that we have a nice little caravan. It's really nice, remarkable. I mean, you are on the outside, it looks like a caravan, but when you're on the inside, it's totally different.
Oh, wow.
It's a wonderful clinic, well set
Fully
up.
equipped.
Fully equipped. And from time to time, we move it around. So we would be stationed at a particular school for like a semester or 2, depends on the need of the school. And once that school is completed, we would have moved to another school. So all 4 schools are serviced by a mobile dental unit, fully equipped, where we do everything for the child that is needed, the extractions, the fillings, the cleanings, the sealants, fluoride treatment, education, all of those things are done across the board for all the schools.
Yeah.
So as I said earlier on, that the model that is created by the Cayman Island government all through is exceptional.
Yeah, it is.
Exceptional.
You know what's weird? Because I'm trying to think back when I was a child here and just remembering if we had dental care. And I do believe we did. I'm not sure. I'm not 100% certain. Because maybe you can answer this question for me because you would have knowledge of just the past of what HSA provided.
Yes.
So I don't know if it was a nurse or there was a trailer outside for dental care. I don't remember ever getting dental care in primary school or even, no. I don't remember it being there at John Gray.
Which school did you go to?
So I attended Georgetown Primary, which is now renamed to the principal that served there for a long time, and a teacher. And then I went to, of course, George Hicks, and then John Gray.
Yeah.
But I don't remember a dental care trailer being out there at the time.
Yeah.
I remember trailers being out there, but I think there were more for nurses, or there was a nurse office. But I don't specifically remember ever going to dental care during that time. So you guys have come from very far.
Right.
Yeah.
As you notice, it's evolving.
It is.
It's something that probably we started off with just particular visitations, but now that we are much more settled, we are establishing a more permanent presence as we go along. So the 4 schools or the 6 schools that I listed before, they have, of course, a permanent presence there. We are looking forward, especially for Joanna Clark, which is the Savannah Primary School, which is the second largest primary school on the island by government standard in terms of government schools. And I want to just use that time to encourage the powers that be, so that we can have a permanent presence at Joanna Clark. The population is about 500 thereabouts.
Oh, wow.
So we would basically need a dental clinic there. At present, it is serviced by the Caravan, the dental mobile unit.
I love that.
So as we go forward, we evaluate and then we move forward. We evaluate and we move forward. So that's good observation.
Love that, man. We're going to take a quick, short commercial break, and when we come back, we'll speak more to dental therapist Fabian Blanc, who's joining us. We're lucky to have him join us here in the studios today. If you have any questions, please go ahead and send us a message through our Instagram or Facebook at Bobo 103.1 FM.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
All right, we are back right after that short commercial break, joined by dental therapist here in the studios today, Fabian Blanc from HSA. And we're talking all things, of course. The subject matter today is National Children Dental Health Month. Great topic. We talked about the school programs just a few minutes ago before we jumped into a commercial break. Now we asked the question on which schools are you guys located? Who are you taking care of? And I was pleased for, of course, Fabian to announce that it was pretty much every single government school.
Yes.
And that is a high achievement. That's something that definitely deserves an applaud. We spoke about the high schools. We spoke about the primary schools, even preschools. What services are provided to the preschools level, though? That's a very young age. So what service are you guys providing to the preschool level?
All right. Before I go on, I must say that we also have a presence on the Cayman Brac as well.
Oh, yes. Listen. I'm glad that you said that, because our Cayman Brac and Little Cayman listeners always get offended when we only talk about Grand Cayman.
Yes,
so
that's
thank
true.
you so much for putting
that
out
there. Of course, we have the Creek and the Creek School. And
yes.
We have the West End School. They are also covered. We have a dental professional, dental therapist on island who gives coverage to those two schools. And they are doing wonderful because, the population is small, so you have more of a one-to-one interaction.
Yeah.
And it's wonderful.
Yeah.
So for the primary school, for the not primary
preschool,
school, but the preschool, we provide more of a dental screening where we will go in from time to time, identify the different preschools in the particular region, whether it is in West Bay, if you are in West Bay, or in East End or North Side.
Mm-hmm.
And we would go in and just do a screening, a quick look at the mouth, in the mouth. We would now use that information, whatever information that we gather, we would, of course, call the parent and educate the parent as to what we found.
Yeah.
And to just encourage them to, step up a little bit higher if there is need for stepping up. We also offer nutritional counseling as well. In an age where snacking is the thing, this is one of the things that we are, pushing heavy on more than any other time.
Yeah.
As it weighs heavily on your dental health.
Yeah.
Snacking is one of the things that we encourage parents to take note, be cautious, look at what you give your children. The kind of snack, the snacks now they are high in sugars, they are high in even sodium, salts, they are high also, not only high in sugar, but they are sticky.
Yeah. So
the chance of being removed from the tooth surface by just a simple brush, it's much more complicated
and
now than then.
What snacks would you say that the individual should stay away from?
Well, just the artificial snacks.
Yeah.
And I would say all of the sticky toffee and the chocolate, all of those, because it not only affects their oral health, but also their overall health. Now, what we also educate parents from preschool, at the preschool level, we say that the mouth is the mirror of the body.
Yeah.
And the reason why we say that, and you can take this to the bank.
Yeah.
The reason why we say that is that any sign of depreciation of your health, overall health, for example, whether you are a diabetic, one of the first signs that is detected that you can use to, is that a diabetic has dry mouth. So whatever is happening inside of the body, it's reflected in the mouth as number one, as the first sign.
Yeah.
Right. And two, one of the reasons why we actually talk to parents at that small young age. Think about it. I really want us to think about it in this way. Your teeth, or the enamel, is the hardest substance in the body. The components of the teeth, which is hydroxyapatite, what makes up the enamel, is labeled as number 5, the hardest substance overall. Decay is able to break down the hardest substance in the body.
Yeah.
So if you find a child with multiple or rampant caries, it means therefore that their diet is predominantly sugar. Now, you can tell what is going to happen later on if they continue on that path. But we recognize that this is where we come in with the intervention, where we say, okay, now we recognize that child's diet has too much sugar.
Yeah.
Why? Because we have all of these caries, all of this decay happening, cavity is happening, child is in pain. And so by the parent pulling back and giving a much more healthier kind of snack or food, which is fruits and vegetables and those things, you can actually intervene in the child's overall life or health in terms of cutting back or reducing even early onset diabetes.
Yeah.
And so this is one of the approach that we take in terms of our nutritional counseling. We also offer guidance in weaning children from bottle. A lot of children are stuck with the bottle.
Yeah, they are.
And
they are.
Yes, so we provide guidance, and we don't want the parent to just remove the bottle. But there are different phases and stages in how you approach this. Right. So all of these are provided at the preschool level. It's more educational and the screening at that level, and consultation with parents as well.
Love it. Now we're gonna move on to primary care. This one can kind of fit in for, I do believe, because you mentioned some things that parents need to be very aware of. So there's something that I want to discuss later on when we reach to the high school level. But can you talk about the care that's provided to primary school students? Or the services, I should say, sorry.
So the services that we provide are numerous services, which is one, in addition to just the screening and the education that we do, educational sessions in various classes. So we find ourselves being, asked to conduct certain sessions in various classes, and we would go in with our models and our, projectors and stuff, just to allow the students to see and to engage in those discussions where they are actually actively, the demonstration is, live before them. We also provide fissure sealants.
Yeah.
Or what is fissure sealants? Remember when you were younger and your grandmother has a nice table and it's really, really nice and pretty, well, with nice gloss and everything, and she doesn't want anything to scratch it.
Yeah. So
what she does is that she would put a nice plastic covering over it.
I remember.
So if at all you come with your juice and the juice would spill, it won't harm the furniture, right?
Yeah.
So this is basically the same concept, that the fissure sealant, we would cover the tooth. And you ask why? All right. So for the posterior teeth, or for the teeth that are at the back, which are the molars, whenever they are erupted, they are consider them to be mountains and valleys. So you notice that there are some, we call them, there are some peaks and there are some lows and valleys, mountains and valleys. So because it's not smooth, your teeth are not smooth, it's mountains and valleys. So what happens is that the valleys are so fine that the toothbrush really cannot get in between to clean out the food particles that are there. So what we do is that we say, we need something to ensure that it is kind of smooth, like a skateboard ramp. So that's why we flow now the sealant in there, a particular liquid that flows in the valleys, and it gets hard once we expose it to a particular light.
Yeah.
And that now, once you eat any form of sticky substance or food, once you use the toothbrush, it can be better removed. So that's what the sealant does. It gives a level of protection by preventing food particles from sticking in that valley.
Oh, wow.
Or sticking in the fissures,
Yeah.
as we say. So we call it pit and fissure sealant.
Love that.
Also, we provide fluoride applications. We recognize that in terms of nutritional value, we don't receive all of the nutrients that we get from food. So we would give topical fluoride it's a particular paste that we put on the teeth surface of the tooth. We also would do fillings where needed, where we have cavities, fillings. We put in fillings. We would have moved away somewhat from the silver filling or the amalgam filling, and we put more of a tooth-colored filling, which is called the composite, which is good. It's better. And we also offer referrals for orthodontic treatment.
Okay.
So if you notice that your child has some form of crowding, then we would offer referrals. And we say, okay, yes, it fits the criteria, then we can refer you to the orthodontist. The plan is that pretty soon we would have our own in-house orthodontist at HSA. So we're still a work in progress. So let us see how that goes. For the high school, it's all of the above that we have mentioned for the primary school, but also we go along further where if the child is having pain and the tooth needs to be extracted or reach the point where it has gone the distance, we also offer root canal treatment to that child, and also other preventive measures and the continued screening. So it's a lot that we do, and one of the things and it's for advantage for the parent, because you are at your workplace and your child is receiving dental health care free of cost. You don't have to leave, and you are just right there. You're just right there.
Love it. And then also moving on to high school, which is our last one. Just to get a little deeper into the services that are offered, because I'm pretty sure it's a little bit different now because we're getting up there in age.
Yes.
What is the services that you guys offer at HSA?
Right.
For high school students?
So with the high schools, it's much more of a restorative treatment, where we also do the screenings, we do the educations as well. We are also involved in career guidance. So we would meet with the students and we'd say, listen, these are the different disciplines that are within the dental structure.
Yeah.
And we would give guidance. So we also partake in their educational expo to further guide them along the way and say, okay, this is what you need to be a dentist. These are some of the qualifications that you need to be a dental hygienist. These are what is required of you to be a dental therapist, and so on, so that they become aware of the different disciplines within the dental fraternity, right? So that's one of those things that we also do as well, in addition to all of the dental treatment, which are the fillings, the cleanings. We do a lot of cleanings, and the cleanings just to remove the plaque and the heavy deposit calculus that sometimes accumulate on the teeth. We also encourage the high schoolers to do, and everybody too, but more so the high schoolers, to ensure that they receive their dental visit once every 6 months.
Yeah.
And to do their dental cleaning once every 6 months. Preventive measures like fissure sealants and fluoride treatment are always ongoing for the high schoolers as well. And braces, which we of course recommend for braces as well. As you know, that because they are teenagers, they are much more conscious, aware of their looks. So we highly do referrals for our braces.
And then you spoke earlier about preschool level. There's certain things that you're talking to parents about when it comes to certain things that the kids are eating. Mm-hmm. In high school, as they advance, they take on different substance that they eat. Mm-hmm. I notice with kids that are in the teenage level, they tend to, obviously the sweets, they never get rid of it. Even some adults, regardless of their age, never get rid of sweets. But what I see that a lot of young people are intaking is like a lot of, especially the boys, a lot of sports drinks, which contains a lot of sugar.
Whole heap of sugar.
Yeah. And a dentist, for some reason, no matter where you go, in which country you travel to, the dentist always seem to tell a lot of these students, you gotta roll back on the amount. I won't name the product just in case we insult any distributor here. Right. But there's only one particular sport drink they always talk about. Roll back on that.
Yes.
So
yes,
you could talk a
yeah.
little bit more to that. Obviously, we don't want to name the distributor or the
none at all,
the
none at
product,
all.
but yes.
But just generally speaking,
yeah.
a lot of persons, a lot of parents as well, because we work with parents and educators as well, may think that because it's a liquid, it has no harm.
Yeah.
There's no harm to it.
Yep.
And so these are some of the things that we when we are educating our parents, we say to the parents, when your child is going to bed, and the only thing that they can have that is okay, even after brushing, is water.
Yeah.
No, if you drink anything with sugar, any juice, any liquid, milk, chocolate, tea, whatever it is, that sugar is much more potent than what you would have eaten. So, because the sugar is already broken down and it stays on the teeth for a longer period of time, and it's very, very active. It turns to acid created by the bacteria that basically produces or cause caries or dental decay. And some person will say, "But I'm not eating anything, but I just brush my teeth." But did you drink any of those type of drinks? I said, "Yes, but there was nothing on my teeth. It's smooth."
Yeah.
So the sugar settles on the teeth surface.
Yeah.
And it does damage. So for our sports, for athlete persons, or especially the high school students who are in sports, we really encourage you to cut down on those drinks.
Mm-hmm.
You might need it for energy, yes, as they say, but cut down on the drinks, or if you have them, now you can bring your toothbrush.
Yeah.
The aim is that the sugar should not stay on the teeth for a long period of time. So bring your toothbrush and do a light brush.
Yeah.
And then you'll be okay. So just to be aware that these things really cause damage, even if there is no particles or remnants left.
Mm-hmm.
But because you don't feel it, doesn't mean that it's not there. So whenever you have either some coffee or some tea or some sweetened drinks, it is just as potent as the food. More potent as the food.
Fabian, I'm really enjoying this conversation only because it's very educational and we forget things. Because even as adults too, I mean, we're talking about Children Month right here, but at the same time, we still make those comments. Yeah, go ahead. Yeah.
We would. One of the things that we educate our parents is the prevalence of the baby bottle syndrome. And you ask, what is baby bottle syndrome? Well, it has several names. We call it early childhood decay or rampant caries. We will see that in children, basically, about age 1, 2, and 3, just early onset cavities. But what causes it? When a child is at the breast for a long period of time, or actually taking the bottle for a long period of time. For example, a mother would wake up in the night and breastfeed. They're 3 months old baby or they're 2 months old baby, they breastfeed. And as soon as they are through breastfeeding, they will put that child to sleep.
Yeah.
What we are saying to the parent, that there is still sugar in that breast milk. So it settles on the gum, and then it penetrates. And when you have the teeth coming up at about 6 months and older, then it comes up already weakened. Right? So we are saying to the parent, be mindful, have a nice clean gauze beside your bed, kind of wet it a little bit. Once you are through breastfeeding, you take that gauze and you just wipe the gum. Just a nice sweeping action, and put that child back to sleep.
Yeah.
The same thing with the bottle. If the child has teeth and is taking the bottle, before they go to bed, don't allow the child to fall asleep with the bottle in the mouth, because that liquid, as we were talking about, would settle right on that tooth surface, and you will have all of the child's teeth being, of course, decay, and that it's very painful sometimes.
It is.
You see it and you cry, because at that time, the child can't masticate or can chew the food properly, because most times it gets so bad that they are in pain. You have abscess here, and it impedes now in just the digestion. And if you can't digest properly, then you won't absorb the proper nutrients from food.
Absolutely, yeah.
So it's a lot. So we have been educating, and our parents are very, very receptive. They are trying all these things. They will let you know that I did it, and I'm doing it, and this is what is happening. And honestly, we are getting positive feedback from our parents. And also our teachers as well, who are working together with the parents, because sometimes we cannot get to the parent directly, so we give the information to the teacher, who actually gives the information to the parent. So it's a nice little collaborative effort, and you see the importance of the Dental Health Month for children for February, which was contributed by the ADA. So it's a collaborative effort that we have together.
Love it. This is dental therapist Fabian Blanc that's joining us here in the studios. We're going to take our last commercial break now, and when we come back, we will wrap things up. And it's very important talk. Guys, we always say, if you have any questions, please do not be afraid to reach out. We've always passed these individual questions off to the individual guest that's with us, or to the marketing team of HSA, depending on the question that you ask. So just go ahead and share it on our Facebook or Instagram at Bobo 103.1 FM.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
All right, we are back with Bobo 103.1 FM after a short commercial break. Staying hanging out with you, I am your host for this special segment, and we hope that you have questions. And if you do, we have a way for you to ask those questions. You can send it through our Instagram or our Facebook or social media at Bobo 103.1 FM. We have, of course, dental therapist joining us today in the studios, Fabian Blanc. It's a pleasure to have him here, just filled with so much knowledge. He takes care of a lot of our kids here locally, too. So to celebrate, obviously, National Children Dental Health Month, we brought in the right individual to ask the right questions. One of the things I want to jump right into, Fabian, is what are the most common dental problems seen in children locally? Big question. Big one, because parents think they have the answer to this one, but you may be surprised with some of the things you come up with this one. Yeah.
Just cavities, just a lot of cavities, a lot of decays. That's number one. And we see within the early ages of 7, 8, 9, 10, those are the ages where we see a high level of cavities. We also are seeing some form of gum inflammations that are coming about because of the abscess that are forming. So whenever a tooth has gone beyond repair, then the body is actually trying to is fighting to keep it to stay alive, and then there is a lot of gum inflammation, which we call abscess. We see poor brushing techniques being done, and parents are coming in with their late first visit. So we won't see a child in our dental clinic about 3 years old, up until 3 years old, and we're saying that age is late, it's too late. We are asking you now to just bring them for just a checkup. We're not going to do we might not do anything for that child in terms of, but just to let the child be aware that, this is a place, and this is what we are doing. This is the person who's supposed to be taking care of your teeth. So we ask you to start as early as, or begin as early as 1 year old. And one of the other problems, we have orthodontics problem.
Yeah.
There's a lot of crowding as a result of early loss of the baby teeth. So if you lose your baby teeth too early, that's one of the reasons, then it can give rise to crowding, and you would need orthodontic problems, or braces, as you would say, braces issues.
Which is the problem we had with our now 17-year-old.
Yes.
He lost his teeth. And I was,
too early.
Yeah, I was very concerned how often he was losing his teeth, by the way, because it didn't happen to our youngest son right now.
Right.
He was pretty normal. He's losing teeth every so often now at this age of 11 years old. But we kind of find that, when our oldest was younger, he was losing it. Yeah. Just by playing rough, like different things he was doing, he was just losing it. And depending on what he was eating also.
Right.
So those are some of the common problems. Now, this one is a big one because it's weird, right? Because we did hear of all the schools that you service on the island. But are the students, is it a mandatory for all students to come to the dentist, that when you guys show up there, is it mandatory? Because this question can go either way. Because I'm asking now, how often should a child visit to the dentist? But you are in the school, so is this something that's mandatory for them to visit anyway? But if it's not, and you just say you're in private school and the parents don't have it in the private schools.
Yeah.
How often should a child be going to the dentist?
Right. So it's once every, if everything is okay. If everything is okay with that child,
Yeah.
the child has a good oral hygiene and no cavities, everything, we ask for once every 6 months, which is twice a year.
Yeah.
Right. And at that visit, you will get your regular checkup, also your cleaning. It's not mandatory. We encourage persons to come. What we do, even before we begin treatment, we would send a consent form to the parent. So if the parent decides that, listen, I have my personal or family dentist, that's okay.
Yeah.
So they won't sign the consent form, and we won't actually proceed with treatment. So we have, we send a consent form highlighting all of the things that are needed, and if the parents so desire, then they can sign the consent form, giving us permission, procedure by procedure, for that particular child. If not, then they can refuse the consent form, and of course, we trust that they will take them to their independent or provider of choice.
Okay.
At that time.
That makes sense. And we like to work in partnership with what you're doing, especially when it comes to our young kids. So what should parents be doing at home on a daily basis?
Mm-hmm. Brushing twice a day. We are asking parents to ensure that the children brush twice a day. But you can speak and it won't be as effective. So we're asking you to model that as well. So you brush twice a day as well. Morning after breakfast, and of course in the evening after you have had your dinner. At the beginning, what we are saying to the parent is, what we're encouraging parents to do is to just be present with your child, be present in that area, vicinity, in the bathroom, where the child is brushing, and observe how the child is brushing. In certain cases, we ask the parent to provide brushing techniques to that child at particular time. For example, we'll say to the parent, allow the child to brush in the morning, so that, because we are now trying to let the child gain some form of independence.
Yeah.
Allow the child to brush in the morning, but you see, nighttime, we're asking you to do it. So that, and as the time goes by, you just give little guidance until that child can actually brush effectively, accurately. So we encourage also parents to allow the children to drink a lot of water.
Yeah. Important.
It's important, not only for dental health, but for the overall health. To drink a lot of water and to just build a brushing routine. At my home, we have a brushing routine. That, so much so that if you have not brushed your teeth, you can't sleep.
Oh, wow.
I mean, you just really can't enjoy your sleep.
Yeah.
So we have a brushing routine, and so you develop your little brushing routine pattern with you and make it fun.
Yeah.
As a parent, to make it fun, make it enjoyable. Have a song playing for the little ones, or with directions. Brush your teeth, brush it up and down, so that you can make it something that is a joyous occasion.
I love
to
that.
the parent.
Love that. What I want to discuss is I skipped past this one because I want to ask this one before we end our segment here. But you're dealing with the kids, obviously, in school. You see that there is an advanced treatment that's needed.
Yeah.
How do you go through that process in contacting the parents, or what needs to be done? Do you guys make a decision to say, no, this is advanced, we'll take over from here? Or do you guys have like a procedure or a policy that you get the parents involved?
Right.
Yeah.
So at the beginning, because that we have the consent form and receive the consent, if there's an advanced treatment, for example, that child would need a root canal treatment that we don't provide in the primary school setting.
Okay.
We would basically refer, because everything is done in-house. Even if we are a satellite clinic, everything comes back. So all the procedures that we do at the school, they come right back to the main dental clinic, so that the dentist who is in charge can see what is being done. So we have a particular referral program that if that child needs additional treatment, for example, orthodontics or even root canal treatment, we refer that child through the system, and that child will be given a particular schedule or time, appointment to come in and have the assessment done, where we can take more x-rays, we can do the procedure, and then of course that child will come back to us and we continue whatever other treatment that is deemed necessary at that time.
Yeah.
But it's pretty smooth, no headache to the parent. But we will be keeping contact with the parent in terms of establishing the time and date and everything. So it's not a headache at all for the parent. We take out the hassle from that for the parent and allow that to be a smooth transition.
Yeah.
So it is done at most of it. We have 2 clinics right now. and one at the Anthony Eden Hospital, and then we have one at the Marines Dental Clinic.
Okay.
Two clinics basically, and those the parent can either go to one of their choice.
I love it.
Based on how we refer the parent.
I absolutely love it. My last question for you before we send you off, Fabian, is the big one here. I was reading this article. I forgot where I was reading it, but they were talking about different fears that people have. Obviously, signs of a shark if they were to go into water. Some people don't go in and jump in the water. Public speaking. Then you have, obviously, flying. It's a big one. But then dental care was in that list. so how do you battle the anxiety of going and seeing your dentist? Like, what recommendation do you have for parents? Because that's a big one.
And that's as you say, that's a very, very, very big one right now. It's surprising to see. I tell you the truth, that's why I really praise the effort of the Cayman Island government for having this wonderful structure, and even HSA for carrying it out as well. It's surprising to see. And I wish I could invite you to the schools. Even the teachers, they would have grown up in their time, and whenever it's their time to go to the dentist, you know what they would normally do? Just run away.
Yeah. But I was one.
Yes, it's surprising to see, and the teachers are even baffled now to see that the children are running to the dental caravan. So we can see that it is working, that the dental anxiety that once exists, I can say it's becoming a thing of the past. No,
yeah.
Honestly, it can become a thing of the past.
My kids love it.
They run. I enter a classroom for one particular child.
Yeah.
And let's say that child name is John Brown. And I said, John Brown. By the time I call John Brown, I have 5 different hands asking the teacher, can I go? Can I go? So you can tell that, based on the early intervention, because we are in their lives from an early onset, from 1-year-old, 2-year-old, 3-year-old, they grow accustomed with us. And also, we give incentives as well.
Yeah.
So every child lives with a little toy, a little sticker, a little toothbrush, or something. So they're looking forward to these things. So it's a joy for them to visit the dental clinic whichever area they are. It's a real joy, because especially for the younger ones who get their little stickers and their little cartoon characters and stuff, they are very, very happy, and they go home rejoicing.
Yeah, I love it. I love it.
So by doing those things, and you recognize that the anxiety, dental anxiety, is in the Cayman Islands. It's no more. Well, for the government primary school where we have a presence, it's going all through the door.
I love that. That's one of those topics I wanted to touch on. Fabian, it's a pleasure to have you here on the radio today. You touched on a lot. Your excitement resonates over the airwaves. People can tell that you love your job.
Definitely.
Yeah, you 100% love you. That's one thing I could say from this interview, and we appreciate just the amount of knowledge that you've instilled in us today. So we hope we see you again, because it just wasn't enough time for all the questions that we have.
Yes.
But if you do have any for him, it'll be our pleasure to pass it on. Just make sure you message us on Facebook and Instagram at Bobo 103.1 FM. Thank you, Fabian.
All right.